Now, what did doing this study tell you that you did not know, let's say in March? We're now in October. And I ask you this because one of the early sort of set of interviews you did with me and certain other media colleagues had people gunning for you, calling you alarmist because of the numbers you put on the table. And at that time, you had projected pre-lockdown, there was no lockdown then, up to 300 million cases and 2 million deaths. And, I remember after I telecast that interview with you, you were like, the Prime Minister understands how serious things are, otherwise he wouldn't be doing this national lockdown. But you got really scrutinized for that data. And I want to ask you today that given this new survey, what do you say about those previous projections? Were you wrong? Were you alarmist? Had you overestimated it?
So I would say that, so again, with the reminder that we were making these projections with no inkling that India was going to go into a lockdown, right? We couldn't call for things, but it's up to the government to do these things. In the absence of the lockdown, we had said that there'd be a few 100 million cases of COVID. Now, did that come to pass? Yes, because the serology studies seem to indicate that even with a harsh lockdown, that came to pass. So I don't think we underestimated the numbers of infections at all, because because that was the easier piece to predict. I think on the mortality at that stage, we had literally no information on mortality rates in India. We had some information out of the Chinese. That was pretty much it. I think that, first of all, mortality in India is underestimated. I certainly think we have more than whatever the 80,000 or 100,000 deaths. I think we're undercounting by a factor of 4 or 5. But even so, I think that we, at that stage, we were using a mortality rate of about 0.8 to 1%. Is it possible that that is a mortality rate now? I think it's lower now. It's because that the lockdown enabled a delay in cases so that the medical system was better able to take care of people. And your chance of dying today of having severe COVID is significantly lower than what it would have been back in March. We found that in our study. So we found that people who had been tested positive in March or April were about 13% more likely to die than people who were tested 2 months later, were about 26% more likely to die than people who were tested 4 to 6 months later. What it tells you is that the intent of that lockdown, and I'm not defending the lockdown just for the lockdown's sake, I'm saying that we were trying to delay the cases somehow. I think that delay helped because today clinicians don't lose as many people to COVID as they would have 6 months ago, just because they know how to deal with these cases. So in that sense also, the mortality will come down because, again, we were projecting for a world where we were going to see that flood of cases happen at that point in time. If I had the chance to reflect back and say what would have happened, back then, knowing everything we do now, I think we would have been in for the numbers that I projected you back in March. I stand by those projections.
You stand by the projection on the infections or on the mortality?
On the mortality as well. On the mortality as well. I think that when you adjust for the fact that that we're undercounting now, that you adjust for the fact that we're seeing lower mortality because of improvement in medical care. If I had to go back and with the information today say, if there's no lockdown, what would have happened back in March? I think we would have headed for that 1 to 2 million deaths and hundreds of millions of infections. That would have certainly come to pass because there's nothing, it's not like the mortality rate has come down vastly. It has come down, like I said, by about 26% as far as our study goes. Now, that said, I think going forward, the projection is a lot better because we have much better survival rates. I think any critical care doctor that you speak to, Barka will tell you that they're losing only about 40 to 50% of severe COVID cases today, where they would lose about 80% of them back in April. So I think things have changed a lot. So we are in a better world from that perspective.
So just one more question on this, because you're saying you essentially stand by your numbers and the intervention of the lockdown, the progress in science, medicine, treatment, therapy has brought down certainly the mortality. But in terms of the infections, even with the serological surveys, even with under-testing and all of that, our numbers are less than 7 million. Your projection was 300 million, I think, by sometime now or even earlier, by July, August, right? Yeah. Even if that's 40 times... Sorry?
with no intervention, with no
With no
lockdown.
with no intervention. The caveat being with no lockdown. That was the extreme scenario. Do you think that the infections have the data bears out your projection on infections, and if so, how?
So back in March, the serology study conducted by CMAR indicated that about 7 or 8 million Indians were infected. At that point in time, the actual number of infections that were reported were about 60,000. 60,000. Okay, and we're talking about 7 or 8 million infections. We were undercounting by a factor of about 100 back in April itself. Okay. Now, since then, the serology studies, regardless of the part of the country, regardless of who's doing it, have indicated that we're undercounting anywhere between about 40 to 50 all the way to over 100, 120. So that is the level of undercount of the reported cases compared to true infections. If today true infections are at 7 or 8 million, is it inconceivable that 50 times 8 million, which is 400 million, is the actual number of people who have been through infections today? I mean, give or take 100 million. I mean, remember, we are not counting that precisely here. I think that's absolutely true. And I think any epidemiologist worth their salt would agree with that. The fact of the matter is that we are under testing, and you can look at Pakistan as a comparator. And I bring up Pakistan only because people ask me this question: why does Pakistan have half the mortality per capita of India? Pakistan has half the mortality per capita of India because Pakistan has the testing, which is 1/4 that of India on a per capita basis. So if we don't test, we're not going to find the disease. You find that same distinction within India itself. The states that do a good job of testing, whether Maharashtra or Tamil Nadu, Andhra Pradesh, Kerala, Karnataka, these all are states that are showing up a lot of infections as well. And if you don't test, then it's just going to be a silent and a buried epidemic.
But do you think that now we know that fewer Indians, for reasons that we do not understand, different age group as well as your own study shows, between 50 and 64, there are more deaths, but fewer Indians are dying from COVID than we previously feared? In other words, the IFR, the infection fatality rate, is significantly lower than in other parts of the world. And that will, of course, at some point will be juxtaposed with your projection of 2 million, 1 to 2 million deaths, minus any intervention. I need to keep underlining that.
Yeah.
Do you think you got your understanding of mortality totally wrong? Now, given what you know now,
Again, to go back, given the mortality that we would have expected back in March or April, I think that's what would have happened, which is the 1 to 2 million is what we were on track for, even knowing what we do now. I mean, today's information is based on how medical science has progressed. That's what it reflects. It's not the underlying part of the disease. Now, the infection fatality rate, let's talk about that for a second, because there's a lot of misunderstanding about this.
yeah.
There is a perception that perhaps India has done far better than other countries. Now, India today ranks somewhere, I haven't checked recently, but it's probably number 70 in the world rankings for deaths per capita. It's probably about 75 for infections per capita. India is 108 on testing per capita. So we are worse than average on testing, and we are higher than average on cases per capita, adjusting for our population, and also deaths per capita. I don't think there is strong evidence that we have performed better than the rest of the world. And I don't think, again, I don't put it down to India as fighting this battle on its own and performing. I think India has done extremely well. I'm impressed by a lot of the public health response. And in fact, I was telling a reporter yesterday, she was asking what the difference was between the US and India. And I said, US had the health system, but not the leadership. And India had the leadership, but not the health system. And this is really where we were really lost because we don't have the systems to fight COVID in the way that other countries do. So, given that, we've done actually quite well. So, let's be very clear. It could have been a lot worse than what is going on right now. But that said, I think this infection fatality rate story that we are somehow better than other countries is not really true. You will find that people who test more have found more, people who test less have found less, and that captures a lot of the story. And these numbers will come to light much better in weeks and months, ahead as there's more research happening. And let's just not go off of the numbers we have right now because we don't have a good understanding of the epidemic.
So largely for that time, minus the intervention, you stand by your projections.
I think so. I think we were not wildly wrong. I think that's what we were on track for.